Hi, everyone. My name is Sean Greco, and I am a second year medical student at the Sydney Kimmel Medical College at Thomas Jefferson University. Before I go any further, I want to give a really quick shout out to the other collaborators who worked on this. I have all of their names listed there at the bottom. This could not have gotten done without everyone's support. Today, I'm going to be talking about analyzing the effect of interview time and day on emergency medicine residency interview scores. I have no disclosures. So that first title can seem a little complex, but really what it boils down to is, do temporal variables affect residency interview scores? Essentially, does the time of day that the interview took place matter? And does the date that the interview took place matter? Every year, thousands of medical students are going to be applying for residency. And if they're given the opportunity to interview, the first question that's going to pop in their head is, when should I schedule this interview? This will be quickly followed by, does it matter when I schedule this interview? This is evident by the fact that if you just take your phones out right now and Google that, you're going to find 1,000,001 answers. You're going to find blog after blog and page after page. One of my favorites being, don't schedule around a holiday, because if the interview facilitator has bad feelings about that holiday, that could impact your interview. That sounds absurd to me. However, there is no clear-cut evidence to refute some of these claims. The effective date has been studied, but we went about that a little bit differently, a little bit different methodology that I'll get into. When it comes to time of day, however, that really has not been looked at here. One of the studies we pulled from is an Israeli parole board study. They found that over the course of a session, the rate of favorable rulings from a judge decreases slowly over time until a break with food, and after which it returns to the original level. That makes sense, but what does that have to do with residency interviews? Well, the structure of that is very similar to the structure of an interview day. You have interviews in the morning, followed by a lunch break, followed by more interviews. And that similarity is enough to pose the question, is there temporal bias here? So that needed to be looked at, and that's exactly what we did. We looked at 3 years worth of interviews, the 2016-2017 cycle, 2018-2019 cycle, and 2019-2020 interview cycles at Thomas Jefferson University Hospital in the emergency medicine department. This was 453 total interviews. One of the really great things that we did with this study is we used interview score versus a match-related endpoint. For those of you who may not know, interview score is an objective measure given by the interview facilitator after the interview has concluded. Many of the studies that have looked at date have used a match-related endpoint, which is really good for looking at the bigger picture, but that we're not interested in the bigger picture here. We're interested on the interview. And match introduces everything involved with the match, the whole application, the letters of recommendation, step scores. That's all something that we can throw away and just focus on the interview by using interview score. And when we did that, what we found was that date has no statistically significant effect on emergency medicine residency interview scores. And this agrees for the most part with studies that have looked at the effective date. Time, however, we found also has no statistically significant effect. And this directly contradicts the Israeli parole board study. Both of these data points are depicted on the bottom left for the 2018-2019 and 2019-2020 cycles, with date being depicted on the bottom there with the month, and time being shown as morning versus afternoon, showing the morning interviews and afternoon interviews. In summation, what this means is that we found no temporal bias here at Thomas Jefferson University Hospital in the emergency medicine department. And this is great. You don't usually want to find no statistically significant findings, but that just shows that the process here is working and that there's no temporal bias. And if I interview in 2 years, I know that I'm being interviewed and judged, not the bad day the facilitator may have had. And that's all I have. It was a pleasure to be here. Thank you for having me. I'm here for questions. And if anyone has any questions after today, please feel free to reach out to either me or my colleague, Dr. O'Connell. Thank you for your time.